Welcome. I'm Dr. Ellen Jones, and I'm glad to be here with you tonight. Tonight, we're going to talk about leadership across disciplines, and I'm here at the University of St. Augustine. I teach in the Master of Health Sciences, the Master of Health Administration, and the Interprofessional Education programs. Have taught at the university level for a little more than 12 years and taught in a lot of different professions. So I'm excited about this topic. See if I can get my slides to move. So a little bit about me, some of the settings that I've worked in, and this will explain some about my interest in this topic. I started out in athletic training. I've done health education. I worked in public health at a state agency and at the local level. I've worked at a medical center, worked for nonprofits, worked for foundations, both at the national level, the state level, and the local level. And I'm a professional health advocate. I've also worked at colleges and universities. So I've seen firsthand the need for interprofessional leadership. Today's workshop is called Bridging Boundaries. And here are the learning outcomes. We want to talk about leadership across professions, talk about leadership development in all healthcare professions, competencies that we'll need as we're used to in our own individual disciplines, and propose a transdisciplinary framework for leadership. We'll also at the end share some implications for practice and suggest some resources for faculty. So questions as we get started. Why is interdisciplinary leadership important? And what is your ability to bridge boundaries between different disciplines?
Sorry,
I hope that some of the information that I shared today will help you look into those.
I'm here to help. Get to know Siri at apple.com.
Uckel says that influencing, facilitating individual and collective efforts to accomplish shared objectives is really the definition of interprofessional leadership. Therefore, leadership is a role that we all assume at some point. This may be for an hour, for a day, for a couple of weeks, or for our whole career. But therefore, aren't we all leaders? Traditionally, leadership has been profession-centric. That means it focused on one profession. And here we see probably an athletic trainer working with a client. But profession-centric means that it's grounded in the missions and values of that profession, and it implies a hierarchy of practice. We'll see that this is very different when we talk about interprofessional leadership. Interprofessional education in healthcare, there are lots of folks who've defined this, but one is IPEC, the Interprofessional Education Collaborative. And they say that interprofessional collaborative practice is key to the safe, high-quality, accessible, patient-centered care desired by all. All of our disciplines are talking about patient-centered care, so we need to look at this interprofessional approach. IPEC also says that achieving that vision requires the continuous development of competencies by health profession students and students in other professional fields as part of the learning process so that they actually enter the workforce ready to work with other professions. This is a new concept. I would be remiss if I didn't talk for a minute about servant leaders. The definition of servant leaders, Robert Greenleaf says, is that a servant leader is servant first. It begins with the natural feeling that one wants to serve first. And the Greenleaf Center for Servant Leadership, if you have not looked into it, it's one of the leading sources of information about servant leadership. I would encourage you to look at that. Aren't we all servant leaders at the University of St. Augustine? All the students that I work with have this as their basic theories of being in practice. So servant leader focuses on growth and well-being of people and their communities. So no longer can we think about our clients or our patients just in a clinical setting. We have to now think about them in their communities. A good example is a diabetic who comes into the emergency room, and we send him or her home and say, in addition to what we've done here, you need to eat healthy and get exercise. But if the communities cannot support that, then we're giving mixed messages and not full care. So traditional leadership is accumulation and exercise of power. It's one at the top of the pyramid. The servant leader, on the other hand, shares power, puts the needs of others first, and helps people develop and perform as highly as possible. So when I'm working in a servant leadership mode, part of my job is to make you do the best job that you can. The servant leader shares power, puts the needs of others first, and helps people develop and perform as highly as possible. This is important as we work with students in different professions for them to think about going out into the field with a responsibility to help others work at the highest level possible. So notice on the left, we have more of a web model. This is in contrast to a hierarchy model or a typical org chart with one at the top. Look at the web model, and that's a model for leadership across the health professions. As our framework for health leadership, we're going to use the Garmin model, which looks a little bit busy here on this slide, and I'm going to take it a little bit slowly. The Garmin model uses the National Center for Healthcare Leadership domains. And this means they looked across professions in allied health, in medicine and nursing and dentistry and allied health, and tried to find competencies that fit into two domains. One was the action domain, and the second is the enabling domains. And they looked at leadership models from all of these different professions, and they outlined the competencies and then divided them into either action domains or enabling domains. And what they found was that among the professions, 85% of the competencies were shared among more than one profession. So that's how they got into these action and enabling domains. Let me take first some things that we're very used to and talk about the action domains, and specifically the sphere here of execution. Some examples of actions that we'll take as an interprofessional approach under execution, and this really means how we do our job, but things like performance measurement, process and quality improvement, and project management. So when we use this with an interprofessional lens, we're thinking about project management across the disciplines. The idea of huddles around patient care is one good example. The next one I'd like to talk about is relations, the relations sphere. So relations includes collaboration across disciplines, not just with our own peers, team management, and talent development. I'll talk about talent development for just a minute. This means talent development in our own units, so nurses and nurses, but also nurses in combination with physical therapists, occupational therapists, speech and language, etc. So our interprofessional approach is not just discipline-centric, but it's interprofessional. The last one that I'm going to talk about here is transformation. Transformation includes things that we've all been learning about in our recent leadership courses, things like information seeking. Is our information seeking outside of our own discipline? And the community example was one good one to jump back to. Are we looking at information about the community, about the zip codes where people reside and what's available, what resources are there? We're looking at change leadership. Leadership for change, transformational change, and we're looking at innovation, support for innovation and risk-taking. Now, all of those three spheres overlap in our diagram, and the bigger sphere is called boundary spanning, and boundary spanning is one of the action domains that allows all of those three things to happen at the same time. So in boundary spanning, we're talking about things like organizational awareness, community collaboration, and network or relationship development. And network and relationship development may take us outside of the healthcare field and put us into some other arenas. For example, business and industry, transportation, public education. So we find that we have people, interprofessional leaders, serving on education committees, serving on safety committees, etc. And these are the things that are actions around boundary spanning. Let's talk about some of the enabling domains. And the first one that's getting a lot of attention today is health systems awareness. This includes business literacy, financial management, information technology, and human resources. These are not courses that would have been taught in allied health several years ago, but are critical to the success of students and professionals today. Another component of enabling domains is self-awareness and self-development. That includes self-awareness, a lot of the inventories that we take and self-assessment techniques. It includes self-confidence and well-being. We've seen a lot post-COVID about mental health of healthcare practitioners. This all falls under the enabling domain of self-awareness and development. And underpinning for the whole model, the Garmin model, is values. And these are in three different areas: our personal values, our professional values, and our organizational values. So let's talk for just a minute as we wrap up about implications for practice. The implications for practice here are that interprofessional leadership needs to apply to our professions. No longer can we be profession-centric. We must be interprofessional. To our faculty, so that we're reaching across departments and across chairmanships and across disciplines. And for our students who need to come out of the field, out of undergraduate and graduate programs, prepared to work as interprofessional leaders, and together, professions, faculties, and students working towards advocacy for interprofessional approaches. One good example here is attention to the social determinants of health, things like housing, literacy, employment, and those are things that we can advocate together across disciplines. So let's go back to our first questions. Where have you already done advocacy? And where do you picture yourself as an advocate in the future? Our first questions were, why is interdisciplinary leadership important? And we see that it's not only important, but it's imperative to the success of interprofessional leadership. And our question about our own ability to bridge boundaries between different disciplines begins with reaching across professional lines in our current work setting and goes all the way to advocacy for an interprofessional approach to patient-centered care. Let me share some of the resources in addition to NCHL that we use tonight. Remember that the NCHL is the Garmin model. And that's our first reference. Also, the Greenleaf Center for Servant Leadership is a wonderful resource. The Interprofessional Education Collaborative, IPEC, and UCL, the definitions of interprofessional leadership. So I want to thank you for participating tonight. If you have questions, you can put them in the chat and we'll go from there. I hope you'll attend Module 2 of this iLearn series. Thank you.